Now in these maybe we may require about 10 to 15 lectures, and in those 10 to 15 lectures we're trying to cover the practical aspects about the antimicrobial drugs. Now in why do I say practical aspect? Because we are not going to cover any theoretical thing. You will be able to understand at the end of these lectures about when exactly we are going to prescribe these drugs, when exactly we are not going to prescribe these drugs, how exactly we are going to look for the side effects, adverse drug reactions, how exactly we can combine few of these drugs together more effectively, and how exactly you can choose the drug. Now why do I say choose the drug? That is most important part of the practical pharmacology, because any indication you can see in pharmacology or in medicine, you can get the list of the drugs, maybe 1, 2, 3, 4, 5. Google will definitely going to give you the list of the drugs. Let's say for example you ask about to the Google about treatment of hypertension, the Google is going to give you all those drugs. So there's no point in teaching you the list of the drugs. What is most important in these practical aspects is to choose one of it, and to choose one of it is the most difficult task. Yes, artificial intelligence may help you, but finally it is your judgment that cannot be given by artificial intelligence. That is the reason in medicine it is very difficult for the clinical acumen to get developed, because clinical acumen treating physician develops after years of practice. So yes, artificial intelligence is definitely going to help you to choose. Let's say for example if you ask the patient, my patient has got hypertension and diabetes, so what drugs are not supposed to be given, how exactly I can prescribe, but all the details of the patient. Let's say for example you will have to also enter about patient's ka liver function test, renal function test, patient ka weight, patient ka past medical history, and all those things you will have to enter into artificial intelligence, then it can develop. And maybe these all these things you can do the calculation and your permutation combination in your mind if you know the patient well. So that is the reason the artificial intelligence has got a role, but is not going to be the final deciding factor, because ultimately when you prescribe the drugs, of course this becomes a little bit away from what we are going to learn in pharmacology, because ultimately doctor's job is to prescribe the patient proper drugs and also to take the responsibility. AI is not going to take the responsibility, and that is the reason nobody can claim कि मैंने AI से दवाई ले लिया, मेरे को साइड इफेक्ट हो गया, तो who is going to be responsible? AI will say you did not fill the proper data, you did not take the drug properly. Of course you cannot argue with AI. So that is another, I am planning to take some of the lectures about in AI in medicine and AI in pharmacology, where we can understand about the role of AI, artificial intelligence, in pharmacology. But of course that is a little bit more evolving field, and it is very difficult to make a judgment right now what can happen in next few years about in medicine. So let's come to today's topic.